Welcome to our continuing series of virtual voices focusing on the United Nations Sustainable Development Goals. Today, we are very pleased to have Dr. Barry Levy, who has studied the health impacts of armed conflict on health, human rights, and the environment for more than 30 years. Dr. Levy is an adjunct professor at Tufts University School of Medicine and previously worked as a CDC epidemiologist, a University of Massachusetts Medical School professor, and director of international programs and projects. He is the past president of the American Public Health Association and a recipient of the Sedgwick Memorial Medal, its highest honor. Over to you, Dr. Levy.
Thank you very much for that lovely introduction, Christine. Let me share my screen here. As we begin, I'd like you to close your eyes for a moment. I want you to imagine what it would be like to be living in a war zone. And for those of you that have lived in a war zone, I want you to recall what it was like. Keep your eyes closed. What do you see? What do you hear? What are you worrying about? How will you react when family members are attacked or injured? What will you do when the food runs out or the water stops flowing? How will you get the medicine that you need? How will you get help when your phone doesn't work and the internet is down? Well, where will you go when your home is destroyed? How will you and your family survive? You can open your eyes now. This exercise is over, but for many people today, this is not an exercise. It is the reality of living in a war zone. Today, I'm going to be talking about the health and environmental impacts of war and some of the things that may be done to minimize those impacts, but also to talk about how war can be prevented and what can be done to promote peace. Can you see this first slide okay?
Yes.
Okay. So first I want to list some of the adverse effects of war and then go into them in more detail. Injury, disease, and premature death, mental and behavioral disorders, violations of human rights, forced displacement, damage to civilian infrastructure, damage to the environment, diversion of resources, and unfortunately, more war and other forms of violence. There are several things that characterize current and recent wars. 1/4 of people worldwide, so almost 2 billion people, live in regions directly affected by armed conflict. Most wars in recent decades are civil wars in low and middle income countries. In contrast to Russia's war in Ukraine, which is an interstate war. Most wars are intrastate wars, and most of those are civil wars. These are data from the Uppsala Conflict Data Program, looking at the types of armed conflict from 1946 to 2020. And the vast majority of them are intrastate conflicts in the upper zones here. Some of them are, an increasing number, are internationalized intrastate conflicts. Those are largely civil wars in which other countries, sometimes as many as 5 or 8 or 10 other countries, are actively participating in one way or another. And only a small percentage are interstate wars. In most wars, the vast majority of deaths are among civilians, and I'll talk about that in a moment. Often civilians are specifically targeted in wars. And there's a huge diversion of human and financial resources, not only during the war itself, but in preparation for war. The United States military budget, for example, is $800 billion, more than the next 11 countries combined. I wanted to talk a little bit about the distinction between direct and indirect deaths. Direct deaths are often from indiscriminate attacks, from bombs and bullets, people like people who were in Osaka during World War II, many of whom died as a result of indiscriminate bombing. But on a personal level, this boy in Cambodia was injured by a landmine explosion. And so these are two examples of indiscriminate deaths. But increasingly, as I said, as civilians and civilian infrastructure are targeted, an example is this village in Darfur, Sudan, which was attacked many years ago. But the majority of civilian deaths during war are indirect deaths, and they're caused in part by damage to infrastructure. What I'm talking about here is damage to farms and the food supply system, damage to water treatment plants. This is a picture in Iraq after the Persian Gulf War in 1991, where women were gathering untreated water from a river. They knew it was likely to be contaminated, but there was no other water available because the United States and allied countries had bombed the water treatment plants. Indirect deaths also occur as a result of attacks on healthcare and public health services. When a hospital is attacked or bombed, not only are patients and healthcare workers killed and injured, but that facility is knocked out of service. So it's not providing healthcare for people going forward. Here's an example of a hospital that was attacked in Iraq soon after the 1991 war in an uprising in southern Iraq. Damage to infrastructure also includes damage to other forms of health supporting infrastructure, including electric power, communication, and transportation systems. But another major cause of the indirect deaths is displacement. There are 100 million people in the world who are displaced, and displaced is too convenient, too nice a term. It's really uprooting of people from their homes and their families, and separating their families and from their communities. Many people are refugees who've been able to get to other countries where there are at least some protections and support for them. But people who are internally displaced within their own country during war are often far worse off than people who are able to get to cross international borders. So damage to infrastructure and displacement are two of the major underlying causes of these indirect deaths. These are data showing the total number of displaced people in millions from 1996 to 2020. The top number in the graph are internally displaced persons who represent the vast majority of displaced people. The middle line are refugees, and the bottom line is asylum seekers. These data are already out of date. They're through the year 2020. But with at least 12 or more than 12 million people displaced in Ukraine and other displacements that are going on in the world, the war in Syria, the war in Yemen, and so forth, there are now more than 100 million people who are displaced. And statistics like these are really people with the tears removed. We need to keep in mind that whenever we show statistics, that there are people behind each of those statistics. I want to talk a little bit about the relative frequency of indirect and direct deaths. On this slide is an analysis by Mohammed Jawad and his colleagues in London, published in 2020 in BMC Medicine. They estimated indirect deaths, these kinds of indirect deaths I was just talking about, among civilians over a period from 1990 to 2017. There were more than 1,000 armed conflicts during this period, and they estimated that there were more than 1 million deaths per year, about 2/3 of them due to communicable diseases, maternal and neonatal diseases, nutritional diseases, and the rest due to non-communicable diseases and injuries. So roughly 1 million a year. Now, this is an estimate. It may have been an overestimate, may have been an underestimate, but nevertheless, it was still an estimate. Direct deaths are, you might say, body counts. They're people who, there are organizations such as the Uppsala Conflict Data Program in Sweden that actually document individual deaths of people killed during war. For the same period of time, they found at about 50,000 deaths per year in state-based armed conflicts. So this is not an exact apples to apples comparison, but it's pretty close. This 50,000 figure, by the way, includes not only civilians, but also military personnel. So what I'm about to say might be an underestimate of the situation. So we're talking about civilian deaths. It may actually, in terms of body counts, it may actually be lower. When you compare these two numbers, the direct deaths by the Uppsala Conflict Data Program and the indirect deaths estimated by Mohammed Jawad and his colleagues for the same period of time, you can see that the indirect deaths outnumber the direct deaths 20-1. Now, the direct deaths, no question, were undercounted. And it may be that the indirect deaths were overestimated. But nevertheless, this points to the fact, and this has been documented in specific wars, like the Civil War in Democratic Republic of Congo, where similar findings were found. That is, the indirect deaths far outnumber the direct deaths when we look at armed conflicts, all armed conflicts over a period of time. This doesn't mean it holds up in every war. It doesn't mean it's exactly what's happening in the war in Ukraine right now. But nevertheless, it points to the fact that we need to give equal, if not greater, attention to the indirect deaths that are caused largely by damage to infrastructure and by displacement of large numbers of people. The health impacts of war include malnutrition, communicable diseases, mental and behavioral disorders, adverse effects on reproductive health, and non-communicable diseases. And let me say a few words about each of these. Malnutrition has multiple causes in war: reduced food production, damaged infrastructure for food supply and markets, a diversion or delay in the food supply, restrictions of food import. And other issues concerning malnutrition include the fact that infants and children are at highest risk. There's increased risk of infectious diseases, micronutrient deficiencies in pregnant women, and use of food as a weapon. Food has been increasingly used as a weapon in many wars. In fact, most of the great famines in recent decades have been related to war in one way or another. Other issues related to malnutrition are that infants and children are at highest risk. There's increased risk of infectious diseases because people, particularly children who are malnourished, are at increased susceptibility to infectious diseases. Micronutrient deficiencies in pregnant women is an important issue. As I said, use of food as a weapon, and the malnutrition in utero or in early childhood may lead to disease in adulthood. The so-called Barker hypothesis, which was put forward about 30 years ago, showing that people who were deprived of food in World War II, years later, had increased occurrence of cardiovascular and other diseases. Another set of health problems are communicable diseases, largely gastrointestinal diseases like cholera or other diarrheal diseases, and respiratory disorders, acute disorders like measles, which is highly contagious, a major problem in some war zones, COVID-19, and tuberculosis. Contributing factors include damage to healthcare facilities and water treatment plants, the electrical grid, crowded living conditions, weakened public health agencies, as shown here, and increased antimicrobial resistance, which accounts for increased communicable diseases during war. The third area are mental and behavioral disorders. These include post-traumatic stress disorder, depression and anxiety, alcoholism, drug abuse, and suicide. Mental and behavioral disorders associated with war are often the group of disorders that are least recognized, and in fact may have the most profound and long-lasting impact. The so-called scars of mental and behavioral disorders from war often last many, many years after war has been completed. And so the likelihood is that, for example, in the war in Ukraine, that there are widespread mental and behavioral disorders as a result of the war. There are many contributing factors: physical and sexual trauma, family separation, death of loved ones, damage to the environment, loss of employment and education, forced displacement, witnessing torture or execution, and uncertainty about the future. It affects people of all ages, but that perhaps the most profound and certainly the most long-lasting mental and behavioral disorders are those that affect children and may last throughout their lives. There are also adverse impacts on reproductive health because of decreased prenatal care, so important for prevention of complications of pregnancy, decreased presence of trained birth attendants during war and the aftermath of war, decreased access to and decreased quality of postpartum, that is after birth care and care for newborn infants, and reduced access to other reproductive health services, such as family planning. As a result, there's increased complications of pregnancy and increased rates of maternal mortality, increased rates of premature infants and infants who are born with low birth weight, infant deaths, and there even is some evidence from some armed conflicts in the Middle East that there may be increased occurrence of birth defects as a result of exposures that occurred during war. And finally, the last group, so we talked about malnutrition, communicable diseases, mental and behavioral disorders, effects on reproductive health. And the last group are non-communicable diseases, such as the ones shown here, increased incidence of new cases, exacerbation of pre-existing cases, reduced access to medical care and medications. You can imagine that during a war, when people don't have access to pharmacies or medical care to get refills of their prescriptions for just basic chronic diseases like hypertension and diabetes and so forth, there's much more illness, complications of chronic disease, and indeed more deaths that are avoidable preventive deaths, deaths that would not have occurred had the war not occurred. Vulnerable groups, and we've covered some of this already, women, children, older people, displaced people, people with chronic diseases, people with physical and mental disabilities who have, for example, more difficulty evacuating during a war and being able to escape, ethnic and religious minorities who are often persecuted throughout peacetime, but even more so during wartime, and indigenous peoples. We must not forget that, of course, war causes many injuries and mental and behavioral disorders and other causes of death, disease, and disability among military personnel. Many military personnel are serving against their will. Many of them, of course, are volunteering and would serve under any circumstances. But there are many young people, sometimes teenagers, who are forced into fighting, people who are civilians who are forced into becoming military personnel and suffer the consequences of war. I want to talk some about the impact of war on the environment. It affects air, water, and land, and other aspects of the environment. We're talking about a number of things, including greenhouse gases. The US military and other militaries around the world are among the largest users of fossil fuels, and as a result, among the largest emitters of greenhouse gases that cause climate change. Something that's gotten increased attention recently, at least in the United States, are so-called burn pit emissions. These are pits, open air pits, in which military forces such as US forces in Iraq and Afghanistan that burned all sorts of materials and equipment, tires, garbage, fuel and so forth, that unused fuel in the outdoor air, causing intense air pollution, and is now subject of legislation in the United States to compensate military personnel who are exposed. We must remember that civilians in the countries where those wars were fought were also exposed to these burn pit emissions as well. And we need to determine more about what health impacts may have occurred to all people as a result of these emissions. And other chemicals. Whenever there's a fire, whenever there's an explosion during a war, whenever a building is destroyed, there's toxic materials, particulate matter, toxic gases that get emitted into the air that people breathe that may cause both acute and chronic diseases. War affects water in many ways, and both war and the preparation for war affects groundwater with contamination with toxic materials. There are many US, and I'm using example of the United States because that's what I'm most familiar with, but similar things occur among military bases in other countries where the military has dumped toxic substances into waste dumps or directly into bodies of water that have gotten into the groundwater or surface water that in turn leads to other people being exposed to them. After World War I, and especially after World War II, there was large-scale dumping by many countries of chemical weapons. In fact, there's a ship about 55 miles off the coast of San Francisco in the Pacific Ocean that is thought to contain large amounts of chemical weapons. But that's just an example of many ships and chemical weapons themselves that were dumped into the ocean after World War II and represent an ongoing risk. And then there's contamination on land. And so not only contamination of soil by toxic materials, but landmines and unexploded ordnance, which is a major issue, including in Ukraine. Defoliants and other toxic materials, such as Agent Orange, that was used by the United States during the Vietnam War. And just the abandonment of military equipment is another example of land contamination occurring as a result of war. This picture and the next one are courtesy of the family of the late Arthur Westing, who took many pictures of the environmental devastation of war. This picture and the next picture represent mangrove swamps that were destroyed during war. This picture illustrates a mangrove swamp in a mangrove grove in Vietnam that was destroyed by Agent Orange. And here are mangroves that were destroyed by bombs in Vietnam. The resulting craters now contain stagnant water that is a breeding ground for mosquitoes and other mosquitoes that carry malaria and other mosquito-borne diseases. In addition, there's contamination of air, water, and land, potentially with radiation and radioactive materials, which has been a concern, a very valid concern in Russia's war in Ukraine. This is a picture of a Geiger counter demonstrating a radiation level 280 times above the upper range of what's considered safe. This Geiger counter is being held about 10 feet above the Teca River, about 4 miles downstream from the nuclear weapons plant in what had been the Soviet Union and now is Russia. And a wide area is contaminated as a result of the production of nuclear weapons there. And indeed, production of nuclear weapons in the United States and other countries has also led to environmental contamination, not only a risk to the workers who are working at those plants, but to the area around those plants as well. And this is a picture of one of 23 nuclear weapons tests at Bikini Atoll in the Pacific over a 12-year period in the 1940s and 1950s. Atmospheric nuclear weapons tests in the Pacific, within the United States, within the former Soviet Union, and other countries have caused widespread environmental contamination. With regard to Russia's war in Ukraine, and there are other people who are viewing this webinar who are much more knowledgeable than I am about what's actually happening there. But some of the effects on health and the environment include the fact that the United Nations has reported more than 5,000 civilian deaths. This is a very, very large underestimate. I believe that that number is much larger, not only due to the direct effects of war, that is the bombs and bullets, explosions and so forth, but also the indirect deaths that we were talking about before due to damage to infrastructure and displacement of large numbers of people. Many dead and wounded military personnel, and as is true in you might say all wars, neither side wants to provide accurate information for understandable reasons about how many military personnel have been killed or seriously wounded or otherwise injured during the war. There's extensive damage to infrastructure that's been widely reported, food and water supply systems, schools, railroad stations, and more than 500 attacks on healthcare. Again, not only affecting the patients, many of whom have been killed or seriously injured, and the healthcare workers there, but also depriving people of healthcare going forward. Displacement of more than 12 million people, the majority of whom have been displaced within Ukraine itself and facing much more difficult situations than those who've been able to escape to Poland or other Central and Eastern European countries. And many apparent violations of human rights and international humanitarian law. It's being urged that people preserve whatever evidence there might be of human rights violations and international violations of international law, so that investigations can proceed, and so that those who have been responsible for them can be held responsible. Extensive damage to the environment, air pollution as a result of fires and explosions, greenhouse gases, I mentioned, contamination of water and soil. Ukraine is a large country, but with a huge industrial base, particularly in the east and the southern portions of the country. I happened to be there about 30 years ago as part of a World Bank team that looked at many aspects of life in Ukraine, and in particular, environmental health and occupational health, and the destruction of factories and other industrial sites is likely to have caused a great deal of contamination of air and water and soil. Many landmines and unexploded ordnance, which may be difficult to clear for some time. Physical damage to the environment and the ecosystem, damage to the built environment, and as I said, the concerns about radiation and radioactive materials, and major indirect impacts of the war in Ukraine as well. Reduced agricultural yields, and at least to some extent, restricted export of grain to low and middle income countries, which will have at least some impact, and maybe a great impact, depending on the degree of how much export of grain is allowed to continue moving forward. But there could be a great deal of malnutrition and famine in many countries around the world as a result of the damage to agriculture and the restriction of grain exports from Ukraine. Increased energy costs as a result of the war, and also increased government expenditures on military. The German government of Germany, in a relatively short period of time, several weeks ago, doubled its military budget, and that is likely to happen. That increase in military expenditures is likely to happen in many other countries, including our own country. And to the extent that governments spend more on military, perhaps for understandable reasons, they nevertheless are spending less money on health and education, the social safety net, and other services that are important to citizens. And then increased probability of more violence elsewhere. Not only other wars, but when soldiers come home, they bring back a battlefield mentality. There's increased domestic violence. There often is increased community violence when soldiers return home after a war. We can talk a lot about the specific things that could be done to minimize or reduce these impacts on health and the environment, but truly the only way to totally eliminate the impacts of war on health and the environment is to eliminate war itself. This triangle represents information from many, many different sources that I've pulled together and demonstrated with this triangle. But one way of thinking about the prevention of war and the promotion of peace are three sets of activity. One is reducing disputes non-violently. A second is reducing the root causes of war. And a third is strengthening the infrastructure for peace. And let me say a little bit more about each of these. With regard to resolving disputes non-violently, diplomacy, arms control are effective measures. And increasingly, we recognize that public health measures that have been applied to address other problems like infectious diseases, in fact, can be used to address diffusing disputes and conflicts before they turn into violent conflicts, and to prevent the spread of violence. A colleague of mine named Gary Slutkin and his organization called Cure Violence Global have been doing quite a bit of work in the last 20 years of taking public health principles that have been used to study and prevent the spread of infectious diseases, and using those same approaches to prevent the spread of violence. And in fact, if you look at the epidemiology of certain types of infectious diseases and certain forms of violence, you see that there are very similar patterns as Dr. Slutkin discovered many years ago. And so some of the same public health principles that have been used to prevent the spread of infectious diseases now can be applied to prevent the spread of violence. Addressing the root causes of war can help prevent war. By this, I mean militarism, which pervades many of our societies. Even to the extent that we use military vocabulary in thinking about things, even in public health. We talk about target populations. We talk about a war on cancer, and so forth. So ways of thinking militarily and military ways of looking at things have really pervaded much of our lives, and we need to re-examine that, and also address the fact that such large amounts of our national budgets in so many countries go to military expenditures rather than to health and education and other things to support the population. Costa Rica is a country that got rid of its army many, many years ago. And it's, if you look at basic parameters of health, such as life expectancy and infant mortality, Costa Rica is near the top in all those parameters in Central America and South America. So reducing military expenditures is a way to improve health and also to improve environmental protection and make sure we have sufficient resources to do that. Other root causes of war include socioeconomic inequities, ethnic and religious animosities, poor governance, and stresses on the environment. And strengthening the infrastructure of peace encompasses a number of different activities that all are interrelated. Rehabilitating nations and reintegrating people after war is over, establishing truth and reconciliation commissions, which have been helpful in the aftermath of wars, particularly civil wars in a number of countries, deploying international peacekeepers, strengthening civil society, promoting the rule of law, and ensuring citizen participation in the decisions that affect them and their families and their communities. My book, From Horror to Hope, also not only documents many of the horrors we've been talking about in terms of impacts on war and the environment, but also a lot of the reasons for hope. And reasons for hope include resolutions of disputes without violence. There are many disputes within and among countries that indeed are resolved without violence. They don't make the front pages of the newspapers, or they don't make the public health journals or peace journals, but in fact, many disputes are indeed being settled without violence, and that's one reason for hope. Another reason is increased protection of human rights and increased recognition of human rights. Generally, a major exception to that is Russia's war in Ukraine at the present time. But if we look at the bigger picture, there's been much progress made in the respect for and in the protection of human rights and the preservation of human rights. Improved and more systematic humanitarian assistance during war, effectiveness of many international treaties. The landmine treaty, so-called Ottawa Convention in 1997, was a major step forward in ridding the war of landmines. And again, there's a major exception now with Russia's war in Ukraine, where Russia has deployed many, many landmines. But on the whole, if we look globally, there's been a massive reduction in the number of landmines that have been deployed, and a vast reduction in the number of countries that are producing and storing and potentially deploying landmines. More and more people and organizations are working to prevent war and to promote peace. And there's increased recognition of the impacts of war on health and the environment. Let me stop here and take some questions and explore some other issues.
Thank you very, very much, Dr. Levy, for an excellent presentation on the effects of war and its ramifications on all aspects of human health and our environment. Also, your suggestion for eliminating war is also extremely important to consider, especially by our leaders and politicians. The statistics on the Russian invasion of Ukraine have been horrendous, and they are continuing. And hopefully we will be able to end this horrible situation and horrible unprovoked war by a nation that doesn't seem to have any regard for anybody on the world. Over to you, Susie, for questions.
Thank you. We have lots of questions from the audience. So first one is, in your opinion, what are the most grave consequences that arise due to war, and what are the effects of war on a nation?
I mean, these are profound disorders, not only among those who are directly affected by, people in their family being killed or themselves being injured, but I mean, throughout the entire nation. I mean, it's just hard to even put into words the profound seriousness and extent of impact on people's lives. Both with specific, identifiable mental health disorders like post-traumatic stress disorder, but affecting people's psyche, the psyche of an entire nation. It's hard to put into words. And these are things that stick with people often for an entire lifetime. So again, it's hard to say that any one of these is more important than another, but one that often gets overlooked is indeed mental health disorders. In part related to that, and I didn't talk very much about it, but today, but is gender-based violence. That is physical and sexual assaults on women and girls. This is a major problem during war. It's something that goes underreported for many reasons. And even to some extent, people who are able to get to other countries and the relative safety of other countries, particularly women and girls, may be at risk for physical and sexual assault or for sexual trafficking. Again, this is a set of problems that gets underreported. People don't like to talk about it. These are very difficult issues to discuss, but in fact are among the most important issues and often not given adequate attention. I might just add that in relation to that, if you take a moment, is that one of the things I try to highlight in the book, and one of the reasons I have so much hope about the future, is that there are people personally getting involved and dedicating a substantial portion of their lives to addressing these issues. There's a doctor named Denise Mukwege, an obstetrician gynecologist in the Democratic Republic of Congo, who began treating more and more women who had been physically and sexually assaulted, came to him for needing treatment, including surgical treatment. And he set up a program not only to address their physical and sexual injuries, but also to rehabilitate them with psychological counseling and with job training. And he and many of his colleagues have been broadening their efforts in terms of treating people, but also acting as advocates within the Democratic Republic of Congo, within Africa, and worldwide to stop gender-based violence that occurs at any time, but in particular during armed conflict.
Over to you, Susie. Next question.
Thank you. What other consequences can be shown in pregnant women specifically, and can the consequences of war affect people with an obsessive compulsive disorder?
Well, I think the second one first. I don't know the answer with regard to obsessive compulsive disorder, but as I outlined, I mean, there are many threats to pregnant women who are vulnerable for a number of reasons during war. For many women, they may be displaced from their homes. They may be displaced to another country. They may be without they're likely to be, certainly if they're displaced, they may be without their support system and people to protect them and provide them psychological support. But they're often without medical care. Prenatal care is so important to identify problems of pregnancy at an early stage and to intervene so those preventable problems can be prevented. But during war, women have higher rates of actually dying during childbirth, of having complications of pregnancy, such as preeclampsia, which go untreated or not adequately treated. They're more likely to deliver prematurely. Infants are more likely to have low birth weight. The availability of care for complications of pregnancy for the women themselves, for the mothers, and for the newborn infants, that care is less available. So in all dimensions of both medical care, but also public health and preventive services, women suffer, including pregnant women who suffer during war and its aftermath.
Thank you. Are there any positive effects of war?
On balance, of course, we're talking about mainly negative effects, but some treatments, particularly treatments of wounded and seriously injured people during war, have been developed during those wars and then used in treating civilian populations after the war is over. So some of what our military physicians and other healthcare providers learned in the evacuation and emergency treatment and support for wounded soldiers during the wars in Iraq and Afghanistan and even earlier wars, what was learned on the battlefield to keep those people alive and to address their wounds and so forth. Some of those techniques and procedures have been used in emergency medical care in the United States and other countries in non-wartime situations. So, I mean, if you're looking for, is there anything positive or anything been learned from wars? That might be an example. I have a calendar up on my wall right now, and it's a picture of the Roman Colosseum. And there's a quote underneath it, which says, history is a great early warning season, early warning system. And so that, one of the you could say a benefit of prior wars is warning us, and we don't always heed those warnings. In fact, we often do not. But one of the you could say a benefit of war is warning us about the devastating health, environmental, and other consequences of war, and that we should do everything possible to settle disputes by nonviolent means.
Thank you. If we're talking about the war in Ukraine specifically, what are the most likely consequences for the health of future Ukrainian generation due to the Russia's invasion?
Well, I think if we're talking about future generations, and the young people in Ukraine right now, it is in the realm of psychological and behavioral disorders. And as the question I think implies, these can be intergenerational effects being passed on to future generations. And it affects, as I said earlier, it affects not only individual people and communities, but it affects the national psyche, so to speak. And so, I think those are the things we should be most concerned about.
Makes sense. When the war began in Ukraine, many international organizations have been taking part in helping Ukraine, but Russia doesn't appear to be paying attention to the appeals of these organizations. So in your opinion, what can be done to ensure that Russia fulfills its obligations to international organizations? Because not only Ukrainians are being impacted, the world is suffering from the war.
Yeah, I don't have any easy answers. That's a major problem. How do you hold Russia, and particularly the leaders of Russia, political leaders, military leaders, how do you hold the people who've been responsible, how do you bring them to account? The International Criminal Court is one venue, so to speak. I'm not an expert in that area, but it's been pointed out to me that that might not be the best venue from a legal point of view, because neither Russia nor Ukraine have signed on to the international agreements that set up the International Criminal Court. But there needs to be some way to hold those people who are, violating basic protections, the Geneva Conventions that are designed to protect civilians and military who are no longer fighting. Prisoners of war, for example, there's been apparently gross violations of the Geneva Conventions. There needs to be ways to develop to hold those who are responsible for these violations accountable, and to enable humanitarian assistance access to the people who have become victims of the war. From what all of us have seen, there've been many apparent violations of basic protections of civilians, including the right of civilians to safely flee combat and get out of harm's way. So much needs to be done to address that, and I wish I had more specific answers.
Yeah, it's a tough question, but thank you for the response. In your opinion, can people in Ukraine restore their mental health, and what can we do to prevent Ukrainians from developing trauma due to witnessing all the tragedies that are happening today?
Well, there's a lot of potential resources internationally, but I want to point out that Ukraine had, prior to the war, a very strong healthcare system, both in terms of very qualified and competent healthcare professionals of all different types and disciplines, and a relatively good healthcare system, including mental health. And so I think the first thought whenever there's rehabilitation after a war is to support the existing individuals and organizations and networks of healthcare providers, including mental health providers and so forth, to help people rehabilitate their lives, rehabilitate their communities after the war. And so people in other countries, international organizations, I think should be clearly making themselves available to Ukraine and Ukrainians and the healthcare system in Ukraine, but we should be supporting them and helping themselves in whatever way we can. But they are most attuned to identifying what the needs are and addressing those needs. So.
Thank you. As a soldier, is it possible to avoid developing mental disorders or trauma? And what are ways we can resolve this widespread problem?
Yeah, I think as long as there is war, there is going to be mental health and, of course, physical and other kinds of health problems affecting soldiers. There's all different aspects of this. The fact that many soldiers, when they're recruited, are recruited with you might say in an information vacuum. They're thought to they're socialized in a sense. They're trained to see the enemy as something less than human. They're trained to believe in some greater cause that's that they're fighting for, and when they actually arrive on the battlefield, they begin to realize that maybe some of the things they were told before the war may not be true, or they have second thoughts about going out and killing other people or seriously injure them. Particularly civilians, but even military on the other side. So I don't think there's any way of avoiding that. Certainly everything needs to be done to support veterans and active military personnel who have developed mental health problems, but I don't think there's a way of preventing the mental and behavioral disorders affecting military personnel other than preventing war itself.
How does the large number of internally displaced people affect the economy of the regions left empty, and how long will it take to stabilize the situation in those areas?
Yeah, I don't know. Again, I wish I had an answer. I'm not an economist. I'm not really a development person as such, but the question points to a major problem that may take a long time to, to restore the economy and something approaching normal life, particularly in the areas that have been, for example, in the Russia's war in Ukraine, that have been really devastated. Another thing we need to keep in mind, and this is true in any country at war, but as an example, Ukraine is the size of Texas, and before the war, it had a population probably somewhat more than 40 million, which would be more than the population of California. So we're talking about a huge country, a large population, maybe a third of the population has been uprooted, displaced, but the situation is going to vary in different parts of the country. Probably all parts of the country have been affected, but certainly some have been totally devastated, and others have been less seriously affected. So, again, I think the world community needs to look. Ukrainians need to take the lead on this, but certainly to the world community needs to support Ukraine, not only during the war, but in the aftermath of the war. And there have been talks about, in terms of economic reparation, should Russia be held responsible for the huge economic costs of the war, and certainly some of the costs of the war in terms of loss of human lives cannot be easily put into economic terms, but the question points out a major problem. It takes years and years and years to develop communities and the institutions in communities, and those can be destroyed in a matter of days or even hours and minutes in the course of a war. So it's going to take a long time, I think, to rebuild, and hopefully Ukraine will feel supported by the people in many countries throughout the world who will support them in that rebuilding effort. But it's not our idea of what reparations look like, or what restoring life in Ukraine should look like, or how it should be done. It's up to the Ukrainians to assess the damage and to point the way towards rehabilitation with support of others.
Can the harmful effects of war be reduced?
Yeah, I think they can be reduced, and I talk about some of this in my book in terms of protecting civilians, protecting civilian infrastructure. We need to, I think, make it clear that there's a price to pay, that people who attack civilians and civilian infrastructure, who do not obey the Geneva Conventions and other forms of international humanitarian law, we have to make sure that they don't get away with, they don't get away with murder, on a large scale, and all the other destruction that goes along with war. So I think we can protect civilians better. We can try to protect civilian infrastructure. We can call out the violations of international humanitarian law, like organizations are doing, to call out the attacks on healthcare that have occurred not only in the war in Ukraine, but in many, many other wars around the world. Just shedding light on what's happening and getting people to see clearly what the effects of war are is an important step in the right direction. Also, improving humanitarian assistance, improving healthcare to the victims, but the ultimate answer is preventing war itself.
Thank you. What do you think is a better approach to control personal emotions, or let them run free and allow ourselves to experience our emotions during war?
Say, in general, as a physician, my belief and based on my experience is that people should not suppress their emotions. And to the extent, I mean, the questioner really raises the issue of, what kinds of support and care there needs to be provided to the people, to particularly children who are directly and indirectly affected by the trauma of war. So I think much attention needs to be given to that issue. By the way, one other thing I'd like to insert into the conversation is that there's something called psychic numbing. That is, when we hear about, certainly in a distant country like the United States, when we hear about 1,000 or 10,000 or 100,000 people who have been wounded or killed in a war or some other catastrophe, our minds really cannot grasp the enormity or the huge amount of emotion that or the degree of depression we might feel if we truly experience that. So sometimes, in order for us to demonstrate the health effects of war, and particularly we as health professionals or communicators or environmental professionals, to the extent that we can focus on an individual or an individual community or an individual situation and enable people to see the horror of that, it's often more effective. That is, by telling stories about the people that are affected, rather than only talking in numbers, where as human beings, we just often cannot grasp the enormity and the seriousness and the widespread nature of the impact of war. But it's a very good question. I wish I had a better answer for it.
Thank you. In our last minute, could you please provide us with some advice on how we personally can help people who now have panic attacks as a result of war, or any tips for people to keep calm and avoid panic attacks during wars like the one in Ukraine?
Well, once again, I'm not a mental health specialist. I really cannot speak to that directly. But I can say that people need in relation to the previous question, we can't shove these emotions, we can't try to simply try to suppress the symptom, the panic attack. We need to, as healthcare providers, as other supportive people, we need to look to the underlying causes and to try to address those. So that would be my answer. And in closing, as I have said in many other occasions, one of my reasons to engage in this work, one of the reasons I wrote my book, one of the reasons I'm here today, is to encourage people to get engaged in these issues in one way or another. It might be, finding people in your community who are refugees and new refugees, and supporting them in acclimating to their new country. It might be people in your family who may have been maybe veterans and may be affected by the long-term effects of war, and making sure that they get adequate treatment. It may be actually directly contributing to humanitarian assistance for the war in Ukraine or wars elsewhere. So there are many things that each of us can do, either individually or through our professional organizations, or civic organizations, or faith organizations, to try to address the impacts of war, but ultimately working towards the prevention of war and the promotion of peace.
Thank you very, very much, Dr. Levy, for a very, very important evaluation of what has been going on. My question to you is, since you have been working with the UN and various organizations, and you also probably work politically, how do you think that people can approach the politicians to think a little bit more on how resolving and making sure that we do not constantly get ourselves in situations where we allow rogue nations to destroy the lives of others?
Yeah, I think you raise a very important question, Christine. I myself have not been directly involved politically a great deal, but many of my colleagues have, and you're raising a very important issue. These are political issues, ultimately, and so to the extent that people engage politicians, asking them where they stand on issues related to war and peace, including the military budget, including the war in Ukraine, including what we as a nation and what other nations do, and what international agencies do to improve the infrastructure for peace. You're absolutely right. We need to engage ourselves, but we need to engage with politicians at every level, including at the global level, to see where they stand, and we need to vote. That's an important responsibility we have as citizens.
Have you also considered what, from your opinion, should be focused on in the United Nations? Next week, there's a General Assembly. There will be Security Council meetings. So far, there have been 3, and of course, nothing has been resolved, even though the Secretary General has been asking for a peaceful or resolution of the problems. Have you thought about what some of the other things that could be addressed in order to be able to help the politicians move in their resolutions?
Yeah, I'm not really expert on the current agenda for the UN or the Security Council in particular, but I would say, as a general answer to your question, what I've been talking about today, that is to enable diplomats at the United Nations, staff at the United Nations, to understand the profound and extensive impact of war, including the war in Ukraine, of course, on health and the environment. I think to the extent that people open their eyes and get to see exactly what these impacts are, it will support efforts to bring about a resolution of this conflict and hopefully to preserve peace and going on into the future.
Once again, thank you very, very much for being with us. And I hope that we'll be able to distribute your ebook as far as possible, especially to the people that might be able to do something about it. And I wish you a very, very good week. Susie, thank you very much for hosting. And to all of you, have a good, safe, and healthy week. Bye-bye.
Bye now.